Welcome. Super excited to see everyone. This should hopefully be a really productive and informative workshop. We'll start just by having people introduce themselves in the chat. I think we'll do chat because there are so many people here and we want to make sure things move along smoothly. But our basic sort of layout for today is we'll do the introductions now to sort of get a sense of who's in the room, so we can like network a little, sort of think about how we want to like create breakout rooms and think about writing the resolutions. And then we'll go through a presentation where we're gonna have some really great speakers talk about like the resolution writing process. And then we'll go into breakout rooms and get started on sort of thinking of next steps for writing resolutions for specific medical societies. So to start, if people could just put in the chat the following information, like kind of Bromberg just did. So put in your name, your pronouns, any accessibility needs you might have, and super important, any affiliation you might have with a medical society, like a society you're part of, the name of the society, and how long you've been active. And also if there's any like medical specialty you're most interested in. So, and I'll sort of read them off a little as we go. I see we have someone from SUNY Downstate who's in the AAPP and works with New York DOH. We have someone in emergency medicine, someone who's with the AMA Legislative Advocacy Committee, Mount Sinai medical student, Albert Einstein, Bronx County Medical Society, Columbia, let's see, Kings County, SUNY Downstate, more Columbia, thinking peds and psychiatry, Cornell, internal med, more Mount Sinai. We have New York State Thoracic Society, okay, and New Jersey Thoracic Society, that's helpful. We have Columbia, and we have Einstein's affiliated with SNaHP, PNHP, Cornell, AFP. I'll put my own in there. I'm Zach. Oh, and we have Betty, who's Bronx Medical Society, SGIM, Cornell. Yeah. Needs. Great. And for anyone who's just joining now, we're just doing intros in the chat. So I'm going to put it in the chat again, but if you could just put your name, your pronouns, if your accessibility needs are met, and any affiliations you have with medical societies, including the name of the society, how long you've been active, and any specialty in medicine you're most interested in. Great. So it seems like we have a really sort of diverse group today with a lot of depth and lots of different specialties. I think we have another one from Swati with the AMSA Gender and Sexuality Action Committee, and the ISSWHS Sexual Medicine Advocacy Committee, PMNR, and we have New York Internal Medicine. Great. ACP, PCSM, SGIM. Hopefully this will, like we have a lot of sort of depth and expertise in this room. So hopefully we can have some really productive breakout sessions after the presentation. I'm going to share a screen now and get started with the PowerPoint, and we'll have Manish Jain and Dr. Eve Shapiro speak about sort of what Medicare Advantage is, why we want to write resolutions about it, and sort of resolution writing 101. And people can continue to share their intros in the chat while we start the presentation. So just... Can people see my screen?
Yep.
Awesome. So go ahead, keep on sharing those intros in the chat for anyone who's joining now. And I am going to have Manish take it away with a little bit of background about Medicare Advantage.
Hi, everyone. Good evening. Thanks for joining. My name is Manish. Can you all hear me okay? Okay, awesome. So I'm just going to start us off with a very brief overview of Medicare Advantage. And then if you want additional resources, I'm happy to share them once this call is over. If we go to the next slide, please. Okay, so Medicare is split kind of into four parts: Part A, Part B, Part C, Part D. Traditional Medicare is Medicare that's administered entirely by the federal government and includes Part A and Part B. Part A covers hospital insurance. Part B is medical insurance, which includes preventative services, outpatient medicine. Part D is a prescription drug coverage programs for Medicare, and then Medicare Advantage is generally what we call Part C Medicare. What Medicare Advantage basically is CMS contracting with private insurance companies, which then administer Medicare benefits to patients. So in terms of how payments work under Medicare Advantage, generally Medicare Advantage plans, so these for-profit plans make bids to CMS that are evaluated. CMS, stands for the Center for Medicare and Medicaid Services. They make bids that are evaluated against CMS benchmarks, which are set based off of traditional Medicare spending for a given county. So CMS will identify a benchmark based on what the average traditional Medicare beneficiary spends. I believe like anywhere from like 95 to 110% of that traditional Medicare spending is determined as a benchmark. Medicare Advantage plans submit bids that are evaluated against the benchmarks. Bids are generally lower than the benchmarks, and Medicare Advantage plans that are selected to participate in Medicare Advantage are then allowed to keep a portion of the difference between the bids and benchmarks, which is called a rebate. And they're supposed to spend this rebate on services like supplemental benefits for Medicare beneficiaries. Can we go to the next slide, please? And so like in terms of the issues with Medicare Advantage, there are many. A lot of it revolves around the payment structure for Medicare Advantage. I'm not going to go into these in depth just because we don't have a lot of time. But one of the biggest issues with Medicare Advantage is that it is a version of corporatized medicine. So there are these private insurance companies that are administering care to beneficiaries through a federal program. And anytime you bring a private insurance company into the healthcare space, you know that ultimately their priorities are going to be to make profits for their shareholders and not necessarily focus on improving health outcomes. A lot of the issues for Medicare Advantage kind of stem off of that. One of them is, the Medicare Advantage plan lobby, which advocates for increases in CMS benchmarks and decreased scrutiny of Medicare Advantage plans every year. Medicare Advantage plans are generally more expensive. So traditional Medicare beneficiaries spend about like $6,500, $6,600 out of pocket a year. Medicare Advantage plans have a maximum out of pocket limit of like $8,800. In addition to this, Medicare Advantage plans also, through a variety of schemes, make more money from the federal government. So some of these are like through bonus payments, which are related to the CMS rating system. So plans that are rated more highly are able to get more money. Upcoding, so Medicare Advantage plans, the rebate that they receive is adjusted based on risk. So Medicare Advantage plans will generally try to increase the risk profile of their beneficiaries by screening for medical conditions and upcoding. And then there's induced utilization. So benchmarks are set by CMS based on the population of people with traditional Medicare and traditional Medicare with supplemental coverage. And because of that, benchmarks are generally higher, and plans are able to receive a greater rebate. In addition to this, there are ghost networks. So Medicare Advantage plans are health maintenance organizations. So you're required to go to providers that are in the Medicare Advantage plans. And research has identified that in some cases, up to 20% of providers listed by Medicare Advantage plans actually don't exist or don't really accept that insurance plan anymore. So the lists are not accurate. Another criticism is prior authorization. So Medicare Advantage plans are allowed to implement prior authorization for approving Medicare services for beneficiaries, which both leads to increased administrative burden and then also decreased care to beneficiaries. And there isn't actually a lot of like research available on that just because there isn't a lot of scrutiny on prior authorization in Medicare Advantage. And lastly, we talked about supplemental benefits that Medicare Advantage plans are supposed to administer. Those are broadly just like used as a marketing tool by Medicare Advantage plans, are generally very limited in scope and use. So you'll hear these like vision, hearing, dental, food benefits. A lot of these are very minimal, and we actually don't have information on how much Medicare Advantage beneficiaries are actually able to take advantage of these benefits. So broadly speaking, it's used as a marketing strategy for these plans. Next slide. I think that's everything. There's a report by PNHP called like taking advantage, and I can share the URL with you all in this chat. It gives a more detailed overview on Medicare Advantage for folks who are interested.
Thank you, Manish, for that very like succinct, but I feel like very comprehensive sort of overview of what Medicare Advantage is, why it's so dangerous for both doctors and for patients. So now I'm going to hand it over to Jen to speak a little bit about like what medical society resolutions are and why they are important.
Thanks, Zach. Am I coming out okay? My voice. Amazing. Okay, cool. Next slide. So just a brief overview of what we're going to be going through for my slides and then Eve's slides. This is our general agenda. We're going to talk a little bit about why it is that we care about writing resolutions, what resolutions look like, and then delve a little bit more into kind of the nitty-gritty of how resolutions get passed, and then some resources and best practices. And Eve is going to be sharing some of her experiences getting resolutions passed. Next slide. So why write resolutions? One of the main targets for Physicians for National Healthcare Program in New York Metro and just nationally, as well as SNaHP, New York Metro and nationally, is Medicare Advantage. This is a big campaign that we're all putting weight behind, and that's why today the focus of our resolution writing workshop is Medicare Advantage. I think folks can understand how the privatization of Medicare is very antithetical to a single-payer healthcare system that's supposed to be for the people. And so a resolution is a proposed statement of policy or some sort of call to action. It's basically a way for us to introduce an idea within a medical society. Sometimes it's used to shine a light on something that not a lot of people know about. Sometimes it's used as a way to increase awareness about a potential solution. So for example, there have been resolutions passed around the New York Health Act, which would create single payer in New York State, or sometimes it's used, or in general, it's used as a way for us to get more experience in advocacy within medicine. Next slide, please. And why is it that we're targeting medical societies? So we know that medical societies sometimes influence and organizationals, or sorry, we know that within medical societies, these resolutions influence their policies. And it's also, medical societies also have some weight in the policy sphere. So some legislators do listen to what medical societies kind of put out as their opinions and their resolutions. So the things that we put through, resolutions that we put through these societies can shift the needle on pieces of legislation. And it is like a very concrete policy and outcome that we're going to be proposing to these medical societies. However, I want to acknowledge that some of the challenges, as some people already mentioned in the chat, is that some of these societies can be very conservative and resistant to change. And also, just because they pass a resolution, it doesn't actually mean they have to follow what the resolution stipulates. Next slide, please. I think I will give it to Eve now, sir.
Yeah, thank you, Jen, for that nice sort of setting the stage for the rest of this presentation by talking about like what a resolution is and why it's so important. So I'll hand it over to Dr. Eve Shapiro, who is going to tell us about sort of how to write a resolution and also bring in personal anecdotes about the importance of resolution writing.
Thanks, Zach. So I just wanted to make, first of all, I wanted to say that even though I'm in Tucson, all my medical roots are in New York. So I went to upstate, I was at Montefiore, Mount Sinai. So when all these names came up, it brought back a lot of very happy memories. So thank you. And I did want to say one thing about Manish's talk when he mentioned that Medicare Advantage is more expensive. It's more expensive to the government and therefore the taxpayer. But for the upfront cost for patients, the upfront cost, the per month cost, it is cheaper. And that's why it is an equity issue, because people with less income tend to choose Medicare Advantage because it's cheaper at the front end. That's not saying long term, but people don't recognize that I'm healthy now, but something can happen and then the cost will go up. So I just want people to be aware how it's kind of like a bait and switch, and that can be used in your deciding of what to include in your resolution. Okay, so for a resolution, and this is pretty much the case. I've done several resolutions to the Arizona Medical Association, as well as the one I'll be talking more about, the American Academy of Pediatrics. Obviously, you need a title of the resolution, and for medical societies, only the delegates can introduce, voting delegates can introduce a resolution. You have to have the title, additional sponsors, and we'll talk about the importance of sponsors and any affiliations. Next slide. So the first part of the resolution is the whereas clauses. And that's why you were introducing this resolution. And you don't have to reinvent the wheel. There are many resolutions about Medicare Advantage, about single payer, all those topics. You can decide which of those issues, of some of those things that Manish mentioned and what I just said, would be relevant to the organization that you are introducing it to. And part of that would be if there's any history in the organization that has done anything similar or something about health policy. So generally, most societies will have a limit as to how many whereas clauses there are. So it's important to check and make sure you have that information. So that the whereas would say the actions, why you're asking for this action, and each new idea has to be a separate whereas. I think there's an example here, so it's pretty obvious. And it would be background information explaining about what about the issue is concerning, and also some, well, the solutions more would be in the resolved section, and why there's some gap in whatever the policy is currently. Next slide. Then comes the resolved. And again, there's usually a limit. The one I did to the Academy, I'm pretty sure it only allowed 2 resolved. So it has to be very clear and to the point as to what you're going to put in those resolved. And that is the formal statement of requested action. And it can be used to guide the action of the organization to move forward on the resolution. And again, each issue has its separate resolved clause. Next. And this just talks about words that are more active are always better to convey the message that you want to get. So the active resolved languages are better than the passive, although sometimes you may have to use passive depending on where the organization is at the point that you're introducing your resolution. Next. So again, what's really important, I'll talk a little bit about this more when I talk about my example of the Academy of Pediatrics. But you want, and as I mentioned before, you want to search the current policies of the organization. Then you have to draft the resolution. Then there's the final draft, which has some oral or written testimony. And most medical societies have reference committees where the resolutions that are going to be introduced to the body as a whole, the House of Delegates, will be decided on. So the reference committee itself can can nix a resolution and not pass it on to the House of Delegates. At least this is what happened in Arizona. And I just wanted to say one thing that's really important. I once introduced, this is a number of years ago, a resolution with another doctor about Medicare for all or single payer. And I was not able to go to the reference committee hearing, which is really important that you attend. I learned that. And then I found out, I said, what happened to my resolution? Oh, it passed. I said, shocking, Arizona, they're all libertarian doctors. I can't believe they would have passed that. It turned out they had watered down the language. So saying something like, we support that everyone should have access to health care, and didn't left out the whole part of how that was going to be accomplished. So, and that can happen. So it's really important that you kind of shepherd whatever resolution you write through the whole process. And the final is to the assembly. Next slide. And these are just some resources that have sample resolutions. Okay, next.
I just, if anyone with access to the PowerPoint could maybe share these links in the chat too, I could.
Yeah, I'll share them.
Okay, so I wanted to talk a little bit about the resolution that I recently introduced to the Academy of Pediatrics, American Academy of Pediatrics, which is an organization of, I think, 60,000 pediatricians. Almost every pediatrician in the country belongs to the Academy of Pediatrics. Next slide. Okay, so what happened? So first, I mentioned identifying the problem. So I got an email from the Academy saying, oh, we're offering a Medicare Advantage plan as a benefit to members. I said, what? This was a few years ago, before PNHP was just starting to begin talking about Medicare Advantage and the problems with it. But it was obvious that this should not be happening. So my first attempt was to try to understand the process. And it turned out that the Academy has a separate component called the Insurance Trust, and that's the one that offers the plan. They contract with a private insurance company. So in other words, the whole process, the whole structure was complicated, and it made the process we had to go through much more difficult. So we first tried, I met with Ed Weisbart and one of the trustees for the Insurance Trust about, why they were offering this and explaining our position. And we really got nowhere. The guy sort of heard us, but didn't really. So that was useless. So we decided we had to go to the resolution route. And the Academy of Pediatrics, which a lot of specialty societies probably have similarly as well, they have a resolution route where members of the society can introduce resolutions. So it would be really important to research anything about if it was to that society, how that process works. So, I wrote a resolution with Bob Vanetz, another PNHP member, and basically we pretty much used the whereases from all the information through PNHP website. And the whereases was to get the Academy to stop offering Medicare Advantage and to educate its members, mostly the senior members, as to why the difference between traditional Medicare and Medicare Advantage, and why we had taken that decision to not offer Medicare Advantage. Now, it's very important, at least in the Academy and probably other societies, to have a sponsor. You can't really introduce a resolution on your own. And so I approached the senior section, and they agreed immediately. And then Bob, who's from California, approached his California. California has 3 Academy chapters, and he approached his chapter, and they also agreed to sponsor. And that is really important. And the other thing is, I've been a member of the Academy for many, many years, over 40 years. And I think that makes it a little harder as students when you don't have that history of knowing people. So the more you can collaborate with people who have more history with the organization that you're trying to influence, the better. So the process there was that there was a sort of a resolution committee meeting. And at that meeting, we had the chairman of the senior section of the academy, who had been the chair of the whole Academy Pediatrics speak, and another past president of the Academy of Pediatrics speak on behalf of the resolution. That was really powerful to have people who were really top leaders of the organization speak on our behalf. So then that was passed, that resolution was passed. So then it was presented at the leadership conference. The leadership conference, and I'm not sure how other societies do that. The leadership conference has the chair of every state or county medical society. I think it's about 160 that come to vote on all the resolutions that were offered. And at the time of where our resolution was introduced, there were about 50 resolutions introduced. Now, in that process, once a resolution, the list of the resolutions comes out to all the members and people can comment. Most people will say, I'm in favor, I'm opposed, but you can make comments. That's where we use PNHP pediatricians we urge them to comment. And we had 60 comments in support of our resolution. That was way more than any other resolution. So again, that's really important that you get support for that organization. So then the resolution was passed, I think overwhelmingly. It was basically unanimous. But the way the Academy works is they pick the top 10 resolutions. The leadership picks the top 10, and those get automatically brought to the forefront to be acted on. And the others that pass can go through whatever process. Now, here's the next part. We're talking about writing the resolution. That is the easy part. Following through, even after a resolution passes, to make sure things get implemented is really difficult and time consuming. I am still working on this resolution. So I have been communicating with a staff member about whether they are dropping the Medicare Advantage option as a benefit to members. Still haven't heard back. And the resolution passed, I don't know, 6 months ago. Ed Weisbart and I are doing a talk on Medicare Advantage to the membership, but that was something I had to initiate. So that's part of the education piece. So, so as I said, it's just an ongoing issue, and it becomes cumbersome. Not every process maybe is cumbersome with a medical society, for example, depending on what you're asking them to do, but it is important to kind of see what the structure of the organization is. And next. So one of the lessons learned, define the goals, know your organization. That's really important. Try to get involved in the organization so you get to know the people in leadership, get support from those in positions of power, get support from grassroots, such as I had the PNHP members, and stay involved until the goals are achieved. And as I mentioned, when I did the other resolutions through the Arizona Medical Association, we weren't asking for as specific resolved, and I think that's what makes it a little harder, but we really wanted to have something concrete come from this resolution. I think that was my last slide. And I wanted to make sure, I see there's a few comments. Yes, I did want to make clear that this is for this specific organization, and everybody would have to look at their own organization to see what that process is. Any questions?
Yeah, we had one question in the chat, Eve, from Sophie, who asked, why would there be a limit on the number of clauses?
I think they just want to have some control over how much they have to read and go through at those committee meetings. And maybe not all organizations have that. I know that was the one that it was in our organization.
Great. Thank you so much for that presentation, Dr. Shapiro. And you touched on so many things that I think are really sort of important to think about as we go forward, trying to, write these resolutions and get them passed. I think something you mentioned, which is really striking and to me, is that it's so helpful to have people that have been involved with these medical societies for a long time and sort of have connections and legacies working with the societies to sort of understand the underlying mechanisms and to move resolutions forward. While at the same time, it's so important to have sort of people that are passionate and young and sort of have the ideas. So the sort of the focus of the rest of this breakout room or the rest of this meeting, that what we're hoping to create is essentially little mini teams of providers that have been in the field for a long time, that know their medical society, and people that are interested in getting involved or just sort of dipping their toes in the water, to sort of work together in a breakout room, try to come up with a medical society to target, maybe come up with like some big idea, like general verbiage of like what type of resolution could be possible in the society. But honestly, almost even more importantly, like really get to know each other as a team and create an action plan going forward for, when are we going to meet next? And what are the next steps to get the resolution passed for this specialty that we're focusing on. So before we hop into that activity, we can take a couple questions, some burning questions. I see it looks like Alberto Williams Medina has a question.
Hola, hola. First of all, thank you so much. This is, incredibly interesting and very happy to be here. I guess my question would be to Dr. Shapiro. I think one of the first things I think of with, the entire resolution writing process is that, a lot of these topics can be also very much on the political side of things. So in your experience, is there kind of a litmus test in regards to when you sit down and write these out? Is there some sort of, confines, if you will, that you draft these resolutions on, considering, of course, how progressive our measures we want them to be, but also considering the political climate that we are in. And, I'm sure it's hard to put into words, but I'm sure you understand what I'm trying to say.
Well, that was another point I was going to make, that you've all seen the nominations that Trump has put forward for the healthcare, which is just one worse than the other. So I think Mehmet Oz is the proposed head of CMS, and his idea is to put everybody in Medicare Advantage by introducing a payroll tax. So the issue is going to be more political, and obviously you can't talk about candidates or people in position of power. So you have to stick with the issues. And I think if you talk about the facts in your whereases, the facts of the patient harms and the kind of ripoff of the taxpayer of Medicare Advantage, and then the resolve would kind of follow from that. It's interesting that, so I mentioned I'm doing a webinar with Ed Weisbart, and the Academy said they were going to sponsor it, the whole Academy. They have to look at our slides before we are allowed to present it. I have never had that happen. So they want to make sure, I think, that we don't say anything too political. And so I think you just got to be careful. And sometimes, as I said, through the process, they may say, oh, we'll take this resolved, but maybe this one is too much for our group. So you just have to kind of see how that goes.
Thank you.
And I see it looks like Shane Solger raised his hand.
Yeah, I was just curious. Does anybody have like templates of pre-written Medicare Advantage that you can share? Sometimes these are just easier if you're plagiarizing somebody else's, and then you kind of like fix something for your society as opposed to everybody trying to come up with something brand new, kind of build off of the work. It sounds like Dr. Shapiro's like nodding her head. Yeah. So
I think that was one of the references that Zach had put.
Oh, it was
It's
for
in the-
okay. I wasn't sure those
I
were just
put it
like
in-
examples. Okay, cool.
And I think, Zach, did I ever send you my resolution?
I'm not sure if you did actually.
Oh, okay. Well, I can certainly do it after if you want to send it out. Because the
Yeah, that'd be wonderful. Thank you.
whereas it would be applicable to really any group.
Just real quick, the link I just dropped, y'all, that's for a Medicare Advantage resolution that you can edit as you see fit. It's the one that I just at 7:39 and a little bit before that.
And I see Dr. Steve Arbach has his hand raised.
Hi, hi, Eve, and hi, Ken. I wanted to touch on, I think the question that was just raised about political. One of the issues is how directly, let's take pediatricians. How directly are pediatricians directly affected, including their own self-interests? And there's some balance there with the organization's transactional relationship with politicians. So, for example, the National AAP has really done an outstanding job on some issues like protecting trans kids, and during the family separation deportation stuff, put out some pretty strong resolutions. And I suspect we'll do so also on Medicaid issues because that's how pediatricians are paid. However, by way of example, we've been asking the National AAP to endorse single payer at the national level. And it has been a top 3 vote getter amongst the Academy members, and then it goes into the black hole of our undemocratic Academy inner workings and disappears. And even though our friends at Internal Medicine did one, and we've even done a version that copied that one that had sort of the either single payer or at least a strong public option, it still disappears. Part of it, I don't know if Internal Medicine is a more democratic organization, if ACP is a more actually democratic organization. There's also something that's referred to as staff capture or lobbyist capture, where an organization essentially gets run by its full professional staff and not by its actual professional members. But for whatever reason, this is the other balance. So, they say, oh, it's too political. And we'll say, well, yeah, but you were really good on trans, and you were really good on abortion, and you were really good on immigrants, and you won't touch this one. So it gets a little weird. And just FYI.
And I just wanted to add, plus the Academy does make money on selling these plans.
Yes.
They get a kickback from the insurance company. So they have a financial interest in maintaining it. And that's another issue that's difficult too.
It's just embarrassing that ACP is doing better. The National ACP does better than National AAP, although in New York State, it's the other way around.
But part of the advantage of getting older and knowing people is that Andy Racine is now going to be the president. So you may not get an upfront answer, but at least you may get a straight answer off the record.
We met with him about this issue. It's a work in progress, let me say.
Okay,
Well,
so
it's your seniority, yes.
So with that, I see Jen is going to share the better template for the Medicare Advantage resolution. And the next step is we've created 5 breakout rooms. Jen created 5 breakout rooms, each sort of labeled with a different area of interest or medical society. And you are all invited to join whichever breakout room, piques your interest the most. We try to create breakout rooms where at least one person in the Zoom has expertise in that medical society. So there will be someone with background in that field in the breakout room to sort of help you out. And the purpose of these breakout rooms is really to sort of get to know each other and to create an action plan going forward more than anything. So I'm going to give you guys about a half hour, and I'm gonna paste in the chat sort of like the ideal of like what we'd like you to try to create at the end of the half hour, which is just one sentence summarizing which medical society you're going to target, the like big idea of the resolution you want them to pass, and just like some sort of plan for like a follow-up meeting with your group. Like we'll meet on Zoom in a week, or like we created this group chat, or we all exchange email, like some sort of concrete, like this is the next time we're going to meet and work on like actually drafting the language and thinking about next steps. So I'm posting that in the chat so you all have it. And while we get the better template, I'm also going to share one other link that I think is important for everyone to know about, which is the link to our Signal chat for New York City Against Segregated Healthcare, which is sort of the umbrella organization that's helping to put on this event alongside with Students for a National Health Plan and Physicians for a National Health Plan. So that's the Signal group link. Signal is sort of like GroupMe. If you know GroupMe, it's like a messaging app. So you can download Signal on your phone and then click that link, or copy and paste it like onto your phone browser, and then you can join the Signal. So that will help you stay up to date on like all of our sort of more global organizing, and you know, stay involved going forward. Right. So are there any questions about sort of the plan for the breakout rooms, or like how to choose a breakout room, anything like that?
Just quick note about the breakout rooms, you can also move in and out. So if you join one and there aren't that many folks, you can just join another one. I just roughly created them based off of what people said their interests were / what they've already are members in. But they're very loose categories. You can move, again, like I mentioned, you can move in and out of them as you see fit.
Yeah. And I like Steve said, it's like WhatsApp, but not owned by corrupt plutocrats. Yeah, exactly, the first signal. And yeah, and also like when you go into your breakout rooms, definitely like I'd say like go around, do introductions again, because I know the intros in the chat, like we sort of just breeze through them. So hopefully you'll get to know each other a little as well.
My browser says that the link doesn't work with Safari.
So it's a separate app for the Signal. You need to download an app called Signal from the App Store, and then you can use the link to access the chat.
Got it.
And yeah, so it works like in Android or iOS, depending on what your cell phone is. It's just a text. Just think of it as like a set way to do text messaging.
Okay. So with that, any other questions before we go off into our rooms and start with the resolution planning? Yeah, Alia.
Hey, I had a quick question. As an M1, I don't know what MSSNY and EMRA.
Yeah, I gotcha. Let me explain each of the groups. MSSNY is the Medical Society for the State of New York. So that's our state-based medical society, and you can see that some people mentioned they were members of like county-based MSSNY, like big umbrella MSSNY, like Bronx County. So that's what that is. Psych is people interested in psych, because we had a bunch. EM is emergency medicine. We had a few folks mention they were interested in that. ACP is the American College of Physicians. And then the last one is just the American Medical Student Association, or AMSA. I can also envision that being like if there are med students who really don't feel tied to any one of the other categories and want to talk amongst each other, that could also be your group.
Welcome back, everybody. So I hope that like was helpful, like a good like venue to share ideas, and whether it was or it wasn't, super excited to sort of hear where we're at right now. This is going to be like a very, very low pressure share back, just like if one person from each group could say like one sentence about like how it went, if there are any plans for going forward, what those plans might look like. And Jen is also going to share a Google form that you all can respond to that to share like sort of more personal, private, or one-on-one feedback on how the session went and what your plans are going forward, so that we can, you know, best help you all. Before I start the share back, are there any questions or any questions to address? Awesome. So I'll just go group by group. And so when I call your group, just if someone from the group could just give a 1-sentence summary of what you all talked about. So I'll just go in order of like the breakout rooms tab. So I'll start with MSS and why.
Alberto, that was us.
Sorry. Okay. Hola, hola. I had the amazing chance of talking to Dr. Keel, Dr. Shapiro, Swati, and Kate. So our one line is going to be this. So we would like to target Bronx County Medical Society to provide strategies on distribution of educational material and ensuring that this educational material outlines the true financial cost and risk of patient harm on Medicare Advantage. And so we ran out of time a little bit on how to regroup to continue this, but that'll definitely happen.
Awesome. And yeah, and through that form, we can help to connect you guys with each other afterwards as well, as needed. And the psych group.
Yeah, so I was in the psych group with Bree, Sophie, Morgan, and Christine. We talked about targeting either the New York State Psychiatric Association, which is like a smaller branch of the APA, or the New York City County branch of the State Psychiatric Association. We're still kind of gathering information about the actual mechanism for drafting a resolution or creating a policy statement. So our next steps are kind of to reach via email to continue to do that research. And then I'll just say for the SNaHP people, we learned that Dr. Appel is on the executive council of the County Psychiatric Association. So maybe we'll work with him, but we'll also see what other kind of folks are in the PNHP New York Metro community that would be able to help us out, since none of us in this group were members of these associations.
That is so awesome. Our ranks run deep. It's always good to find new connections. And how about EM or EMRA?
So I think we talked a little bit about creating something that would, like reject any expansion of Medicare Advantage, but also we had to see where EMRA's at already in terms of like what policy they have, kind of like pre-existing policy, and then see if we can get EMRA to push ASAP, just because as of yet we don't have any ties with them, but we'll push for our next meeting December 26th after we've done a little bit of homework.
That sounds like a really good plan. I'm excited to see sort of what comes of that. And finally, American College of Physicians, or ACP.
Yeah, I can speak to that. So we ended up deciding we would target primarily the New York ACP, and we talked about, besides just opposition to Medicare Advantage, other topics we were interested in, like research on primary care in the state of New York, and also the New York Health Act. We collected emails and started an email chain, and hope to circle back soon and talk more specifics.
Wonderful, wonderful. Email chain is great. I'm excited to hear that. It sounds like everyone sort of is in a good place going forward, having some future plans or thoughts brewing. Please fill out our form. So I'm just going to copy and paste it into the chat one more time. That's also, that way we'll have your contact info and can help connect you guys as needed. I think Betty wanted me to share. Let me see. Jen, did you want to share the announcement?
Yeah, real quick before that, just want to amplify that everyone who RSVP'd, regardless of whether or not you were able to make it, you'll get a copy of the PowerPoint, the recording, the spreadsheet that we shared. Thank you to Maddie and Afnan for working on it, and Morgan and a few other folks who aren't here for putting it together. The spreadsheet of medical societies in which resolutions have/have not been passed by them. You'll also get a copy of the Medicare Advantage resolution that was passed in Vermont and a more watered down one that was passed by the AMA. I'll also include links there. Those were the ones I was trying to send y'all. Apologies for the mix up. And then the follow-up form will also go out. So you'll get a whole bunch of links, but I think most important, if you could please fill out the follow-up form. Like Zach mentioned, I'm going to drop it in the chat one more time. This will make sure that we can keep track of folks and also try to support you and connect you with more PNHP and SNaP members who are interested. And the other last thing announcement, I see, Steve, you have your hand up, is that we are trying to identify some students interested in public health who would want to present a poster at the New York State Public Health Association, specifically to promote the New York Health Act. The conference will be in Ithaca, New York, I believe, and end of April, early May. So if you're interested in that, we're looking for people to create a submission on Medicare Advantage specifically. So you can email us right here. I'll just give you my email. You can email me if you're interested. Once we send the follow-up, you can also email whoever sends out the follow-up if you're interested, again, in being a part of this conference. And I'll pass it on to Steve.
Better if I unmute. You think I know that by now. How many years has it been? I just wanted to encourage all medical students, don't be shy about joining these organizations. Psych, join the Psych Association. Jen, join the PEDS Association, etc. They don't be shy because, oh, I'm only a medical student. It's just the opposite. They are begging medical students to join. They want you to join. They want to suck you in so you'll become national lifetime members. Only a certain percentage of pediatricians, as adult pediatricians, if you will, are paid members. And so from their point of view as a group, they want to suck you in now with the free or discounted membership. And it's only if you're a member that you can be able to be doing any of this stuff. So whatever you think you might be interested in, and remember, this is not a commitment come the match. You can join as a first year into PEDS and decide you're going to match in plastic surgery and no one's going to care post hoc. So I was dropping a few of them in. They all have either free or heavily discounted membership. I think PEDS was called $25. Internal medicine was free. Just join, and also join the state chapter or sub-state chapter in the case of New York PEDS. And that way you'll have a standing to do all this work, as well as other professional networking mentorship stuff.
Thank you, Steve. That's a great point, and I think a really sort of nice touch to leave this workshop on. Because I feel like so much of this work is, like we can do a little bit now, but by getting involved, dipping our toes in now as medical students, and then letting it build over the years, that's probably the way to make so many of these lasting changes. Any last questions or announcements, things people wanted to mention or bring up to the group before we close up for the night? Awesome. Thank you all so much for coming. As Jen said, we will send out a follow-up email with a recording of the presentation. Yeah, I see Steve wrote, thanks, Eve Shapiro. Thank you so much, Eve.
Thank you.
Great presentation.
Hope something good comes out of this. That's great. It's very action oriented. That's great.
Yeah. Yeah, and keep us updated about, what happens with these resolutions. We'll try to check in with you as well to sort of see how things are going and try to connect you to resources. But yeah, hopefully some of these get passed. Thank you, guys. Good night.
Thank you.
Thank you.
Thanks. Thanks.